Hello, my name is Roman Comer. I'm an RNTB resident student with the University of Memphis. Today I'll be performing a required assessment. This is the third video that we'll be performing, and the assessment findings are documented on eLearn. I have uploaded the permission form signed by the patient here, and it has been uploaded to the Dropbox. I have verbalized to the patient everything that we will be doing on today. She verbalizes that she understands everything, and she has, of course, given us permission. The patient is a 23-year-old white female, as noted. She has no past medical history that's specific to any of the assessments that we'll be doing on today, and she is a fairly healthy individual. As a disclaimer, we do have our daughter in the back here, right behind us watching Minnie Mouse, so there may be mild interruptions where she may step in, but we will try to proceed if possible. Also, I was not able to get anyone to video for me, so we're utilizing our laptop, and we're going to attempt to make do with it. But in relation to the posterior views of the assessment, when I'm doing things such as palpating the patient's back and inspecting the back, I won't actually be able to get a direct visual of that assessment, but I will try to verbalize everything and make it as obvious as possible. With that being said, my patient's ready, we're ready, we'll get started. First thing I'll have her do, we're going to perform range of motion of the neck. So if you would, sweetie, I'm going to have you look straight up for me. All right, now look down for me, chin to chest. Okay, now lift your head straight up to the neutral position. All right, now if you will, look to your right, and look to your left. Then bend your chin down to your chest again. Now look to your right and left. Look to your left. All right, now look up again. All right. Was there any pain or anything abnormal, any popping or anything you noticed different in your neck in each position? No issues at all? Okay. I did not notice any crackling, any abnormal sounds or anything as she moved her neck. It appeared that it was a smooth, steady motion, so I'm giving the patient full active range of motion of the neck at this time. The patient did verbalize that there was no pain at all. So with that being said, we'll move on to our next step. Next thing we'll do, we'll inspect the patient's spine. So if you will just turn to the side for me in your chair. And the way that I'm going to do this exam, we'll slide up just a little bit. Okay. And I'm going to lift her back. I'm going to lift your shirt up. And I'm sorry if I have cold hands. I'm just going to look at the patient's back. Can you sit straight up for me? All right, back straight. All right. With her back straight, there are no signs of scoliosis or kyphosis. Her spinal column appears to be in perfect alignment, so she's good there. The next thing I'm going to do is have the patient bend her back. All right. Upon visual assessment of the spinal column, the patient appears to have a spinal column that is in alignment. Here, towards the lower aspect of her, like underneath her neck, I'm sure it's her probably T1, T3. T1 through T3, that's what it appears to be. They do seem to be bigger or a little enlarged, but that is normal for the patient. I'm now going to inspect her spinal column. Or, I'm sorry, correction. I'm going to palpate this patient's spinal column. Just running my hand down, slowly palpating. And I'm actually going to start up in the neck where the C1 vertebrae is. And we will slowly go down. You let me know if there's any pain or tenderness at all as we palpate, okay? You feel anything? Anything hurts? All right. I'm sorry, this was the first interruption. We're gonna give our daughter her phone back and we'll proceed. All right. I'm sorry about that. Anyhow, upon palpation of the spinal column, the patient denies any pain or tenderness. We just have to set her aside for just a second. She denies any pain or tenderness at this time. So we'll proceed to the next part of our exam. The next thing I'll assess for is muscle symmetry. All right. If you will, just relax your muscles for me. And then move your arm up for me. Just flex your arms, flex both arms at the same time. All right. Now relax. All right. Flex your legs for a little bit for me. All right. Now relax. Flex your calves. Relax. Can you flex these muscles here? Relax. Flex your shoulders. Relax. All right. As far as I can tell based on that assessment, her muscle symmetry, bilateral, the muscles are symmetrical with no issues. And the next thing we'll be doing is assessing each joint. There are several joints. I'll start here in the shoulder. Start, if you will. Lift your arm straight up for me like this. I'm just going to palpate here. Any tenderness at all? No? All right. Now you can rest your arms. And I'm going to palpate here. Any tenderness? No? Okay. All right. Now uncross your legs for me. I'll palpate here. Any tenderness at all? No. All right. And then last ankles. Any tenderness? All right. Actually, one more area that I may have forgotten. We'll palpate here in the wrist. Any tenderness and anything notice your wrist? All right. Patient notes no tenderness at this time to her wrist. She verbalizes that there is no pain whatsoever. So what I will now do is have her move everything, if you will. Put your arms back out to the side for me and kind of give me a rotating motion. Is there any pain wrong when you do that? All right. Now take your elbows for me and flex them and straighten them out a few times. Any pain when you do that? All right. Now take your wrist and just kind of roll it for me. Is there any pain when you do that? No? All right. Now, one area I did forget to do, palpate, that I'm going to palpate now is the hips. If you will, excuse me, just going to touch you here. Any pain in your joints there? No. All right. Patient denies any pain in the hips. Now, can you stand up for me? Yes, as far as not only testing your hip joints, can you bend straight down for me? All right, lift up. All right, kind of go to the side like so. Go to this side, the opposite side. Any pain in your hips, you can do that? All right. Patient denies any pain to the hips when she flexes her hip joints. All right, now take a seat again for me. All right, now, if you will, just keep your legs uncrossed for me. Straighten both legs out. All right, now bend them again. Just do that a few times. Is there any pain when you do that? All right. Now with your ankles, just kind of roll them for me. All right. Any pain when you roll? No. All right. Patient denies any pain when she rolls out of her joints. So as far as joints and musculoskeletal goes, we are good there. The next thing that I'm going to assess for is visual acuity. And I will do that. What I will do, I will hold up the patient, I will hold up fingers. I'll cover up one eye, and I will have the patient look and tell me how many fingers I'm holding up with the open eye. If the patient is able to tell me, that'll be our way of assessing visual acuity. All right, so I'm going to cover this eye up. All right, now tell me how many fingers I'm holding up. All right. How many fingers? All right. How many fingers? Okay. How many fingers? Yeah, she does have corrected lenses on. Okay. All right. No, that's all right. If you need them, that's fine. But just realize she does have corrected lenses on. So at one point, she was not able to see due to the frame of her glasses, but she was correct with the right eye. Now, how many fingers am I holding up? How many fingers am I holding up? How many fingers? How many fingers? How many fingers? All right. Now, how many fingers here with both eyes open? Two. How many here? Just look straight ahead for me. I'm sorry. How many fingers? Two. How many fingers? One. How many fingers here? Two. How many fingers here? Four. All right. Patient's visual acuity is great. She's fine. As far as your correct lenses, are you nearsighted or farsighted? Nearsighted. All right. Patient is nearsighted, so even upon assessment, she still did phenomenal. And we're now going to move on to our next step. For the next step, I'm going to grab my marker here. And what I'm going to do is assess her 6 visual six visual fields or fields of gaze. Um, if you will, uh, look to follow my marker for me. All right. Upon assessment of her six fields of gaze, patient findings are noted to be normal. There was no hesitancy, or nystagmus or anything of that nature noted. There was a smooth flow of the eyes in all directions, and the patient felt no complications herself. Um, One additional thing that I was supposed to do, and we will do that now. I'm going to grab my pen light. All right, with my pen light, I'm going to flashlight in both eyes, and we'll check and see what our pupils show us. So right here for me. All right. Typically, in the real world, what I would do is I usually sometimes hit the light because it's hard to see, but at this time, the patient's pupils are about +5, so it's very easy to visualize. But they were +5, and her pupils were equal, round, reactive to light and accommodation. So the next thing I will do, I'm just going to touch your face lightly. You let me know if it feels the same on both sides or not, okay? All right. Does it feel the same there? Does it feel the same there? Feel the same here? Feels? All right, we'll do it one more time. Feel the same there? Feel the same there? Feel the same there? All right. Patient does verbalize that in each field it does feel the same, so we will continue on. The next thing I'm going to do, I believe it's the temporal and her masseter muscle. I may be wrong, but I believe it's the temporal and masseter muscle that we're going to examine now. And what I want you to do is just clench your jaws for me, real tight. All right, now relax. Now, clench them again. All right, relax. Clench them again, relax. Okay. Patient has very strong temporal and masseter muscles, so that is what we like to see. I will now check for a symmetry of her face. This is something that we usually do for our stroke patients. And in doing so, of course, she's not having those type of issues, which everything should be fine. But we're going to examine these things nonetheless and see what we get. All right, let's try to get it. If you will give me a big old smile. All right, nice, pretty smile. Face appears to be symmetrical. If you will, lift your eyebrows up for me. All right, do that a couple times for me. Okay, okay. The eyebrows seem to be symmetrical also. They are both in alignment and they rise equally and fall equally. Now, will you frown for me? Oh. All right, upon assessment, patient's eyes are symmetrical also. So that is good. Blow your cheeks up for me now. Real big. All right, blow there out. Blow up one more time. All right, now blow the air out. All right. Now, can you, I feel like I'm missing something. Can you open your eyes real wide for me? Look straight at me though. You have to look straight at me. All right, open your eyes real wide. Okay. Now, close your eyes real tight. All righty. Upon assessment, patient's eyes appear to be symmetrical also. No issues there. The next thing I'm going to do is I'm going to check her, the position of her tongue and her uvula. So if you would, we'll grab my pen light once more. All right, open your mouth real wide for me. Stick your tongue out. All right, stick it all the way out. I need to see your tonsils. All right, okay. I was able to visualize the material a little bit. Appropriate measures would have been to utilize a tongue blade, but I did not have that available at this time, so we will make use of what we have. At a point assessment of her uvula and her tongue, they both appear to be in great shape. They're pink and moist as they should be, with no signs of inflammation noted, no abnormal lesions or bumps noted to either of those areas. Next thing I'm going to do, I think I may have forgotten to do the whisper test. I may be a little out of order, trying to remember this thing as best as possible in order, but I'm going to do the whisper test, and what I'm going to do is I'm going to whisper 3 words to you. I want you to just whisper them back, okay? All right.
I love you.
All right. Right here. All right. Upon assessment, the patient did verbalize the 3 words that I requested that she verbalize. So that is also a normal finding. The next thing I'm going to do, one muscle that I'm going to assess is the trapeze muscles, which is this big muscle in the patient's back. And there's other set of muscles that we're supposed to be assessing also. And if it comes to me, I will certainly be sure to perform that assessment. What I'm going to have you do is shrug for me. Shrug your shoulders. Okay. Shrug. All right, shrug one more time. All right. The patient appears to have significant, sufficient strength in her trapeze muscles. So that is a normal finding there. I know there's something else I'm supposed to be doing. Okay. Also, I believe it's the sternocleidomastoid muscle. So if you would, I'm just going to hold my hand here. And what I want you to do, I'm going to hold my hand firmly against you. I want you to kind of just turn your head. Okay. Now, I'm going to hold your face, and I want you to turn your head against resistance. All right. Good. Now, let's do the other side. All right. The sternocleidomastoid muscles, upon assessment, were normal in findings, and she is good there. I'm sorry for the small interruption. Like I said, we may have more, but we will attempt to definitely control those. The next thing I'll do, well, we actually assessed her speech. I'm sorry. Video, please. All right. Sorry about that interruption. We actually assessed her speech when we did the whisper test. But if you will say out loud for me, I love you.
I love you.
Okay. Her speech is clear, no slurring noted, no aphasia, dysphagia, nothing of that nature noted. So that there is not an issue whatsoever. I may have missed something. I believe I didn't, but that should have been everything as far as the cranial nerve tests go. Every cranial nerve should have been checked off. The next thing I'm going to do is perform deep tendon reflexes of all the extremities requested. The first I'm going to do is biceps and triceps. I do not have a reflex hammer, but I am going to use the diaphragm of my stethoscope. So we will start this time. All right. First thing I'm going to do is the bicep of the right arm. And what I do is we hold the patient's arm parallel to them, like so. And you just kind of tap right here. And you look for muscle in that movement. We may not get the full out effect as we are not with this patient, but that's probably because we don't have a reflex hammer. Nonetheless, I'm giving this patient 2 to 4, well, 1 to 4, being that we don't have the hammer and we don't have the appropriate equipment. But assuming that if we have the appropriate equipment, it will be at least 2 to 4 as far as the deep tendon reflex goes. Now we'll do the bicep on this side. It'll be a matter of tapping the hammer right here. Actually, I'm sorry. Tapping the hammer here and noticing the jerkiness of it, like how the muscle jerks. I will now do the triceps, and that's just the backside here. Sometimes you can get the patient's funny bone, be a little uncomfortable, but if done appropriately, you tap here and the triceps, you would see that muscle move. We go to the other side. All right. Okay, a fun assessment of the patient's, the biceps and triceps. Biceps appear to be plus are 1 of 4, and the triceps appear to be 2 of 4. The next thing I have to do is the knees. If you would just and we usually go right about here, and the patient usually has to sit somewhere higher, but I don't have a place for her to sit that's elevated, so we'll try to proceed. All right, I'll just give a small tap here. All right, straighten your leg up for me. Relax it completely for me. I'm sorry. Keep it bent like that, relax it. All right. It's the left leg. All right. As I said once more, it would probably be a better exam with the reflex hammer. But upon exam, at this time, I give this patient a 1 of 4. Now I will do the ankle or the Achilles. So what I'll have you do, if you would sit up in the chair, have one leg here, and then put one leg in the knee, or put one knee in the chair. I'm sorry. All right. So what I'll do here in this exam is you tap right where the Achilles is, and upon tapping that, you should notice movement in the foot. I believe that reflex is actually about a 3 of 4. So let's switch legs. And that one worked a little better than the others, maybe because the Achilles is just a little more sensitive. But nonetheless, that was a good exam. All right, once more. All right. She's 3 or 4 on that exam also. All right. We'll let her take a seat. Now, test the patient's strength bilaterally on upper extremities. If you will, squeeze my fingers hard as you can, squeeze, squeeze, squeeze. All right, great. Plus 5, 5 of 5, both extremities, both upper extremities. Push on my hands. All right, there you go. All right, now pull back. Push down on the pedal again. Pull back on the pedal. All right, plus 5 lower extremities. That's 5 of 5. So we are good there. The next thing I'll do, I have the patient walk to test her gait. We'll see how she goes. We'll try to stay in the camera's view. So I'll let you stand up. And this should be conclusion, or we should be getting close to concluding the exam. Sorry about that. But I'll let her walk from here over to here. So walk straight for me. All right, turn around. Now, put one foot in front of the other and walk through me. All right, good. Patient's gait is very, very steady, so no issues at all there. Now, the last thing I'll be doing is the Rumberg test. Actually, I'm not gonna lie. I actually had to look this one up because I've never performed the exam before. But what you usually have the patient do is put their feet very close together, put their hands side by side, and the patient stands. And you watch for any swing, any off balance. If the patient appears to be off balance or anything of that nature, and you just stand straight there for just a second. We'll have our hands a little more there. All right, there appears to be no swing or anything at this time. Now I'll have the patient close your eyes for me. Look straight up for me. Just keep your head neutral and just keep your eyes completely closed. There is mild swaying. Nonetheless, another disclaimer that I forgot to give ahead of time. She is pregnant. She has a little bit of motion sickness at times, so that could be affecting her lumbar. One more thing, now that I said she is pregnant, I did not and was not able to perform the gag reflex because she's a little nauseous already, or has been, and don't want to necessarily stimulate that to make her feel any worse. Nonetheless, like I say, I really do hope I covered everything. I think I did, but this should conclude the video and the assessment. Patient did a great job, so on behalf of myself and the University of Memphis, we do thank you very much. And I know this is the final video. I've enjoyed it thus far. It has definitely allowed me to pep up a little bit on my assessment skills, and thankful for this course. Thank you.